one touchy subject
Mhm.
is when it comes to the driver's license. Either they can't see good or the memory they get lost. And you know it's not safe for other drivers, for mom and dad to be driving. For some of them, it's even part of their identity.
You have to tailor it around their safety. Mom, dad, we've had a few incidents where things could have really been serious. I don't want to see you hurt or, God forbid, someone else hurt while you're on the road driving. There are programs, buses that can transport patients
Okay.
to like their doctor's appointments, grocery shopping, church,
Or
going to
bingo.
dinner, or bingo.
Or
It's a
even the
huge thing.
casino. A lot of them go to the casino too.
Or a casino there. So we can't take away their fun.
Hi, this is the Care Room with Dr. Cindy. Welcome. It's a space that was created just for you. I'm your host, Dr. Cindy, and this is a chance to get up close and personal with me. We're going to talk about the things in medicine that matter to you. We'll talk about the questions you've been carrying. We're going to have some honest conversations. We're going to hold space for joy, struggles, and everything in between. It's care that goes beyond the exam room. Care you're going to take home with you, whether you're listening while you're driving or you're listening while you're exercising. I promise that it's going to be care that's rooted in truth and a deep commitment to walking with you every step of the way. I'm glad you're here.
Hi, everyone. Welcome to another episode of the Care Room with Dr. Cindy. I have a very special guest with us here today. I can't tell you how special she is because she is Dr. Stephanie Jones. She is one of my closest friends for many, many years. I'd say it's been about 20 years or so. I'm not saying my age or anything, right? But
We're
um,
not doing that.
we're not doing that today.
We're not
No.
doing that.
Um, she is one of my longtime good friends, but she is also a very awesome doctor, awesome geriatrician. And I am just so honored that she is here with us and gracing us with her presence and giving us the honor of her time today. But before I mess things up, I am just going to let her introduce herself. Dr. Jones, the floor is all yours.
Hi, everyone. As Cindy said, we're long-term friends, but I'm Dr. Stephanie Jones. I'm a board-certified internist and geriatrician. I've been practicing for close to 11 years, and I'm so happy to be here with everyone.
Yeah, we're so happy to have you and we can't wait to kind of pick your brain. So guys, today we are going to be talking about our parents. Yes. So I know a lot of us, as we age, our parents also age, and we end up in the positions where we're either helping them out, helping them make decisions, decisions about their health, maybe helping them physically. And Dr. Jones's expertise is dealing with that patient population. So today I have a ton of questions for her that I am sure you guys are going to appreciate as well. So, Dr. Jones, before we get started, can you just tell us how you got interested in the field of geriatrics?
Sure.
Yeah.
So I've always loved primary care. So during my training in internal medicine, I really wanted to become more proficient, more skilled in caring for our elderly population. As we get older, we deal with so many complex medical problems, and it could just be overwhelming, not only for the patient, but also for the providers as well. So I really want to become more skilled in caring for elderly patients.
Yeah, and from what I hear and what I see, you're doing a great job. So, can you tell us what are some of the most common situations that you're seeing that adult children need to step in or and talk to their parents about when it comes to their health?
One of the most common situations is like if they start to notice some short-term memory problems with their elderly parents, whether they're calling and kind of repeating the same questions over and over, or they're just not having some difficulty in remembering their doctor's appointments or medications. So when it becomes issue repetitively, that's when the children may get involved, or when one of their parents pass away and it's just one parent at home. So parents and children get concerned about their loved one being by themselves or depression developing, or let's say if there's some sort of substance abuse, alcohol can be very prevalent in our elderly population, or some sort of disability, had a stroke and physically unable to care for themselves. So those are the most common situations that I can see with um, parents and children dealing with their parents as they get a little bit older.
Sure, sure. And I think we all can relate in some form or another. But what when it comes to like having these conversations, um, like even in a close, tight-knit family, having those conversations when you notice something, like maybe, I'm calling mom, I call her every day, but now I'm noticing like, yeah, I kind of have to repeat myself, or I'm saying, Ma, I just told you this. Like, why are you asking me this again? True story, guys.
Right.
Oh, mom is gonna kill
Oh
me.
no. Mom didn't hear that one.
Mom
Mom
didn't
didn't
hear
hear
that.
that.
um, but when you're noticing these things and you're realizing like, okay, I have to do something about it, and we're probably going to have a difficult conversation no matter how tight your family is. Why do you think it's so hard for us to have those conversations?
Well, like your parents, there's always they're leaders in your life, just from growing up. Like they're there to guide you, care for you. And, that role doesn't change even as you get older. So you always will see them in that position in their lives there. But as things can happen as you get older, things can shift where you, as the child, really may need to really help mom or dad when things really start to get serious and concerning. So it's just a really delicate approach sometimes that you have to approach your parent.
Yeah, yeah, because you always get, you're not my boss,
Yeah,
I'm the,
yeah,
the parent here. Who's the parent here? But I'm just trying to help you. I mean, I'm just making a suggestion.
right,
But
right.
for for daughters like me, or if we even have some sons who are listening, what are some don'ts that we absolutely should not do when we're having those conversations?
Well, one, think of like the setting. Like you don't want to have a deep conversation where there's so much chaos going around, or
Right. Yeah.
like there's the TV's on, music's on, multiple family members are around. You really want a calm environment where you can have like a one-on-one conversation with your parent about something that's concerning there. If they're not in a good mood, if something traumatic has happened, or just had like a really poor night's sleep and you notice it, that may not be a great time to have a serious conversation with mom and dad. So you really want to choose the timing as best as you can, where there's minimal distractions, where you can both have each other's full attention and be ready to listen with open ears and hearts.
Got it. So, no noise around, right? And then like a calm environment, and choosing that timing
Yeah,
wisely.
yeah,
Yeah, yeah.
definitely. So it may
Thanks for
not be
that.
great before bed when everyone's tired,
Oh, yes, yes,
so that may be a difficult time.
yeah.
So just choosing wisely.
So there are different cultures, of course, and with certain parents, there are sometimes levels of respect and certain things that you're expected to do and not do. So how do generational and cultural differences play a role in how we should go about this?
Right. That's a very loaded question there,
I know,
because
I know.
there's so many different cultures
Right.
there. But I try to figure it out with each of my patients individually. So some patients will come with their daughter, their son, or their spouse. So I see how they interact with each other, because some may just say, Dr. Jones, please speak with my oldest daughter about this situation there, or please defer to my husband in this situation. So for me, I have to kind of tailor it by each case, just to see what would be the best approach. If I'm still struggling, then I just may have to ask them directly, like, in the event that things are getting tough, and would you want me to speak with your oldest son versus your youngest son? Because as I said, there's generational
Right.
differences that can play a huge role. So I really tailor it per my patient there.
Sure. Sure. So are you finding that sometimes some parents give up that autonomy?
I would say more inclusive, I would say.
Okay. So it's more of a group
More of
discussion.
a group
I
discussion,
see. Got it.
because
Got it.
I can have multiple family members in a room with
Okay.
the patient, but the patient will ask the son to speak or ask the daughter to speak, but they're
Got it.
having the conversation together then.
Yeah. Yeah. And I guess that leads into like those discussions about the POA. And for those listening, POA we call um the power of attorney. That's the person that you appoint. God forbid you're not able to make your own medical decisions. That person will step in and make those decisions for you. I know sometimes that when we try to have those discussions with our parents, we can get roadblocks like, oh, you think I'm gonna die soon? Or, like, why are you planning my death? Or, or,
Like,
um,
I'm not
you know,
going anywhere.
I'm not
I'm
going
gonna
anywhere.
be
Why
here.
are we even talking about this? Or, like, if there are multiple children, I don't want to have to choose. Why should I have to choose? Or I'm not ready to make that decision yet. And there are some who kind of just ignore it or try to avoid having those discussions. So when it comes to having this power of attorney discussion, any tips, Dr. Jones? Any for our listeners and viewers out there?
Right. When they come to the doctor's office, at least once a year, especially those who are on Medicare, we do an annual Medicare wellness visit.
Okay.
So it's a packet patients get before the visit. Within that packet, it speaks about advanced directives. So, including what you're saying, Dr. Cindy, the power attorney or the healthcare proxy. So, it allows the patient to fill out, at least to put the name down that they want to appoint someone. If they appoint someone, then we can get the form. Okay, that discussion can happen. If I do see it blank, though, then that's a conversation that I can start having with the patients there. So we can do that in the doctor's office with your loved one. So if maybe something happened on TV, like someone passed away, a well-known actor, that can like be a segue to bring a conversation. I see this person on life support. Wow, mom, like if you were in that situation, who would you want to speak for you to make medical decisions? So it's taking those opportunities there, especially with those loved ones who are a little bit more resistant and want to make that decision right away.
Okay. And thank you for explaining that, Dr. Jones. But for our listeners who really don't understand, is does this, because a lot of questions I get is this like a will? Is how does that play in with, my wishes after my death? Is it with my property and who gets what? Or um, is it just my health?
Right. So primarily for our sakes, it's just your health there. It's really in the event that you can't make the medical decision for yourself, who
Mhm.
do you most trust can make the medical decision for you? So that's what we tailor to in the health field there. Living wills, can talk about a little bit more about property, things of that nature, your finances, but it's really we're tailoring towards like what do you want, or who do you choose to really advocate for you or talk for you in the event you can't make decisions for yourself?
And Dr. Jones, can you touch on exactly what when you talk about decisions? What, like, I know, of course, we all in the medical profession, we have to ask about, like, okay, do you want CPR? Like, what is CPR? Or do you want to be intubated? Or, like, can you touch on that a bit? Yeah,
Sure. So
yeah,
it can be as direct as you said, CPR. In the event my heart were to stop or I'm no longer breathing, do you want life sustaining measures that will continue your life? So that means compressing on the chest or putting the breathing tube in to give you a chance to recover. Then it could be a little bit more in depth. Just had this conversation with patients today. Um, if in the event they're hospitalized, do you want IV fluids? If you're unable to eat or drink, do you want a feeding tube? Do you want to go on dialysis? So it can get a little bit more specific. And I do have those conversations with my patients who are a little bit older in life, who's having more and more medical problems that's landing them in the hospital. So it can be as, not, I want to say simple, but it can be as talking about DNR and DNI, heart resuscitation or breathing tube, or a little bit more in depth when, hey, we're really maybe coming towards our end of our life, or things are really happening that is really affecting my health, in which my life may not be as long as I would want it to be.
yeah. Thank you for that. Thanks for explaining that. Yeah. So I know I kind of touched on this. And
Mhm.
when there are multiple children or
Mhm.
siblings,
Get dicey there.
how, I know, right? How can, or what advice do you have for siblings who disagree? And I guess this might be a two-part question. One, disagree with mom or dad's decision. And two, disagree with who is appointed.
So, not easy discussions
I
there, right
know.
there. Not easy, not easy. But you really have to understand that not about their feeling, it's really about what your mom and dad wishes are. So that's why one, it's so important for you to choose who you want to be your healthcare proxy or advocate there, because you want someone who can carry out your wishes. Now, like if there's, disagreements, which is natural in any family, I try to encourage siblings. One, let's get all the information. My job as your mom's or dad's physician is to present all the information to you. And then for you guys to have discussion, and really to make it easy is, as much as possible, appoint one person to speak, um, because it would just reduce conflict or miscommunication. Um, so that's why I try to lead towards the family, but always keeping in mind that what is your loved one wishes? Would
Right.
they want to be on this breathing machine? Would they want dialysis? You really is to honor their wishes. And if you know that, that takes away so much burden off of you, so much guilt, like, did I do the right thing or not? So if you can have this discussion with your loved ones, you know, even it's like little conversations here or there, like I said, like they're seeing something on television and as actors on life support, bring up those conversations here or there. You get to
Mhm.
know what your loved one wishes are, and you can honor that. You can honor them, and then no guilt will be on you.
Yeah, yeah. So guys, if you're listening, so if mom said, she doesn't want anything done, if this is it, if she's unconscious, the doctors are saying, there's no hope, she doesn't want to be on life support. That's mom's wish. Even if you want to keep mama alive, you're praying, you're fasting, you're really believing. What Dr. Jones is saying is that, we have to go by what mom or dad wished. what they expressed to us, what was written. If And that's why we like to get things in writing, right? So we prioritize what they wished or what their desires were, rather than what we would personally want. That's so good. Thanks for explaining that, Dr. Jones. So what's one thing you want every adult child who's listening to remember before they sit down and have that conversation? Or like you said, if they're just watching TV and someone famous died, like I think like Hulk Hogan died recently. We
Mhm.
all remember him from wrestling, right?
Right,
It's
right.
like, wow, these icons in your head, they're no longer with us, and you happen to bring up the conversation. You're watching TV or watching the news with mom or dad. What's one thing that you would um, ask that we remember before we have that conversation?
Right. You know, it's put yourself in their shoes, uh, famous saying like treat others as you want to be treated there. So you don't want to bombard like what do you have in your will, or what happens if something dramatic happens to you? Do you want to stay at home, go to a nursing home? You'll put so much fear and concern and, like little doubts in their head. So take a time, see how they would want to start the conversation as much as can, because nothing's perfect there, but see how you would want to be treated and approach it from there. Everyone wants to be treated with dignity, respect, um, a calm tone when speaking with your loved ones, not direct or nagging. That's a big issue as well. So just give a moment and really put thought into it and how you want to start the conversation and then take it from there.
Sure, sure. Do you recommend adult children go to their parents' appointments?
I do,
Yeah.
especially if you're starting to notice some memory problems or they're getting lost. You know, I look disheveled, like, why isn't mom dressed and ready to go, or the garden's not being attended to, and this is her favorite time of year where she loves to be in her garden. So you can just approach mom or dad, like, would you be okay if I come to your doctor's appointment with you there? Just so like we'll be on the same page. I know what's going on. Sometimes we all have the electronic medical records now, and patients can sign up for it, and sometimes even loved ones that can as well if they're given permission. Many a times I get messages from loved ones expressing their concerns. So it's okay if, let's say, if your mom and dad says no, don't come, you can still send the doctor a message. I'm not relaying any medical information to you because of HIPAA. It's their private information that I can't disclose, but you can express some of your concerns to me, and then I can take it from there, start doing some assessments, reviewing the medications, seeing something is awry, and that would help me to further investigate.
Sure. Thanks. Yeah, that's helpful. I know one touchy subject, and I've had to deal with this even in family practice, Dr. Jones, is when it comes to the driver's license. And like mom or dad, either they can't see good, mm-mm,
Mm,
or like the memory, they get lost. Um,
mm,
and it's not safe for other drivers, for mom and dad to be driving,
right.
but they've been driving for ages, and for some of them it's even part of their identity,
Yes,
right? And
absolutely.
here is a doctor or you as the adult child saying to them, I don't think you should be driving anymore. And I
Yeah.
have had patients get super angry, um, because we have to fill out this form as doctors, um, about that. Yeah. So
Yeah.
how can we approach that? Either I'll ask as an adult child that you've noticed this, and then probably as a physician for me.
Right.
How can you approach that as an adult child and not have World War III break out, you know?
Right, right. So not an easy conversation right there.
I
Yeah.
know.
But I think again, you have to tailor it around their safety. Um, if, as you said, they're getting lost when driving or those near accidents where I almost hit someone there, um, then yes, it's definitely time to have a conversation about taking away the keys there. So if you can tailor it around mom, dad, we've had a few incidents where things could have really been serious. I don't want to see you hurt or God forbid someone else hurt while you're on the road driving. It's really time to consider letting the driving go, but still find a way to get you around to go
Right.
to your grocery
Okay.
store, go to do your activities,
Or church.
um, or church there. Sorry, huge because, one, it's about autonomy, being able to do what you want to do, have that
Mhm.
freedom. Um, but then also you have to balance it with their safety as well there. So I know within New York, I'm sure within Pennsylvania, there
Yeah.
are programs, buses that can transport patients
Okay.
to like their doctor's appointments, grocery shopping, church, um, going to their, I think, bowling activity or even
Or
going to
bingo.
dinner or bingo.
Or
It's a
even the
huge thing.
casino. A lot of them go to the casino too.
Or casino there. So we can't take away their fun
Right.
completely. So I think it's important to offer options, where driving may be unable to do now, but there are ways to get you to where you need to do. And then, you as the loved one hopefully will be there for your parent parent. Whether on the weekends you're making yourself available. You can't just take away the keys and not make yourself available to help your loved one there, because that will lead to more social isolation and tension amongst the family.
Definitely, definitely. And for us doctors who have the
Yeah,
unsavory task of taking away the license.
right, right. So honestly, I would say we really try to encourage the family members to do that there. Um, it requires sometimes a few conversations. Even sometimes a patient can go to driving school and do a driving assessment. If they themselves knows that there's a problem, then hey, usually that's kind of like a wake up call, and they're more open to doing that. But yes, we are. I would say we're obligated to really counsel the patients and documenting, like we really counsel them on not driving. There is a DMV form that we can fill out. A little tricky because do need the patient's permission to disclose their health information. So typically, our approach is really getting the family involved, saying like, "Hey, it is time for mom or dad to stop driving," and then doing like a driving assessment by a local driving school, and the patient themselves may be able to really see like, "Hey, I'm not really safe to drive anymore."
Thank you for that. So, just to summarize, to see if I have it well, for as an adult child, I would provide my parent with alternatives, or even volunteer myself. Um, as a physician, I try to encourage the family to have that conversation, and have probably the patient give it up themselves,
Sometimes,
or
yeah,
yeah, if
yeah,
we're
it,
if we're
it, it
we're
happens,
successful, I
because
know. Yeah,
they do get nervous when accident starts to happen
yeah,
there, or like out here in Long Island driving on the Long Island Expressway.
sure.
People are going fast, and so like
Yeah,
their senses are not as
sharp or yeah,
attuned anymore, like if for 30 years ago.
yeah.
So you'll be surprised the amount of patients have said like, "Oh, I gave up driving, or only drive during the day." Um, Usually some do, but sometimes that conversation does
Sure. That would be welcome if it's
happen.
needed and that happens.
Right,
But Dr. Jones, what if a patient is resistant? What if they're like adamant, like, no? And everyone is saying, like, yes, this needs to happen. Like, Dad, you drove into a tree last week, or he had to be evaluated in the emergency room because he was, in an accident, or he got lost like 3 times, just trying to go home. And we all know, once you hear you getting lost trying to get home, that means your memory is,
right.
um, you know, you're having some really bad memory loss there. So what do you do when a patient is adamant that, this is not happening? I'm not going to give my consent.
Yeah.
Um, yeah,
Yeah, honestly, like it's usually the family member will take away the keys at that point there. Or if the you can say, let's say is a memory impairment or dementia developing, car is not starting, we don't know why there. It may just need gas there, but as a family member, you're not going to do that basically there, things like that there. The car, look at that, something's wrong with the car there. We're gonna have to let it sit for a while, or eventually we're gonna kind of get it fixed there. But it's usually at that point where family will intervene and take away the key.
yeah, yeah. Unfortunately,
Fortunately, but
yeah,
as I said, like we have to provide alternatives
right,
because it is you want to maintain your independence, autonomy, regardless of your age. And as you get older, there. But if serious things start to be of concern, then yes, intervention is needed.
sure. So, Dr. Jones, I know we talked about all the heavy stuff now. In your experience, and I know you work with quite a bit of the older population, what can we as adult children do? Because, we're aware that, time is limited with our parents, right? Um, the older I get, the more, I'm aware of time and
Mm,
spending quality time with my
mm,
loved ones, making those memories, especially with my kids, with them taking lots of pictures and all of that. What can we do purposefully to enjoy life with our
mm.
parents? What have you found that, that population really enjoys doing with their adult children, if anything?
Anything.
Yeah,
Obviously it depends on their interests, but
yeah,
a lot
certainly.
of my older patients, they feel like they don't have time with their loved ones anymore. What they say, like they're working, their grandkids are now in college there. So, it's finding, as you said, those ways to spend quality time. Just had a patient this week who told me every Sunday they have dinner with their daughters. The
Oh,
daughters will cut short the vacation so that they're back on a Sunday there.
oh,
So it's doing things like that, having that commitment.
sure.
Um, that's so key.
Yeah.
Another my patient today told my student, make sure you call your grandmother today. Um,
Oh.
so it's a great question because it
Yeah,
is so pertinent for that population there. Because as you get older, yes, family, friends may start to pass away.
yeah,
Um, so your social support becomes smaller and smaller. So being intention with your time, whether you have that phone call on the way home, how is mom and dad doing? Or now, we do FaceTime, Zoom,
yeah,
everything like this nowadays. So there are so many ways of access and spending time with your loved ones. And that's key because social isolation is real. Depression is definitely real as
sure.
in our older patients, especially with the pandemic that really did balloon.
Yeah,
So you do want as best as you can to spend that quality time with your loved ones. And if they like to cook, go cook with them or
with
have
them.
dinner with them.
Sure, sure.
So finding those ways.
Yeah,
Again, like think of yourself in that situation.
Yeah.
We're gonna get to that age as
Yeah.
well.
Yeah.
So you
To
want to
unto others.
cultivate,
Yeah.
do unto others, you do unto yourself there.
So,
So,
yeah, yeah. That's so good. Thank you, Dr. Jones. For our listeners who are listening, and they want more of Dr. Jones, because
oh.
guys, she's awesome. She's been my friend for 20 years, 20 plus years. How can they find you?
Yes. So I am on LinkedIn. Just Stephanie Jones. You'll be able to see my profile. Accepting new patients in my practice,
Yes.
and love to connect with you.
Yeah. Um, so, Dr. Jones, it was such a pleasure chatting with you today. I'm gonna use some of the things we talked about today with my own parents.
Me too. I
I
got to put into practice myself. I got to
and
practice what
tell
I preach.
yep, tell mom and dad I said hi.
I will.
Um, but yeah, this was so good, so timely, and just so pertinent. So I really, really appreciate your time. I appreciate your expertise. We are so happy that you were here, in the care room with us today. We hope that you will come back.
Yes.
So this is you have a standing open invitation anytime, and I will keep asking. But yeah, it
Yeah.
was such a pleasure. Thank you, thank you, thank you.
Thank you. Thank you for having me. This is wonderful. Look forward to more.
Yes, indeed. All right, guys. Stay tuned for our next episode with another fabulous doctor, that will be coming up next week. So see you guys then. Until next time, take care.
Thanks for spending time in the care room today with Dr. Cindy. If you liked what you heard, please subscribe, share this podcast. I'm also on Facebook and Instagram. You can follow me there. Remember, you're not alone in this. There are doctors who do care. The information in this podcast is for educational and informational purposes only. It is not a substitute for professional medical advice, treatment, or diagnosis. Always, always consult your personalized healthcare provider for medical guidance.